You're welcome back to the Pulse on the Giant News channel on Multi TV. Now, the lives of several Ghanaians are in danger following the use of unqualified persons to dispense drugs in healthcare facilities. That's a warning coming from the Pharmaceutical Society of Ghana, who described this trend as a recipe for disaster. The president of the association, Thomas Boateng Apiagyei, who urged government to take immediate actions to address the situation, was speaking at a public forum in Accra to mark the celebration of this year's World Pharmacist Day.
The roles of pharmacists keep expanding, resulting in improved health of many communities. And most countries have integrated pharmacies and pharmacists in public health activities, including health promotion and provision of public health interventions. For example, community pharmacies in these countries have now become vaccination centers, with pharmacists at the center of these interventions. And in Ghana, the pharmacist to population ratio is about 1 in 15,000. This is far below the WHO recommended ratio of 1 in 2,000. For example, in hospital or clinical practice, for pharmacists to be available and actively involved in pharmacotherapy of inpatients, as well as being available as the experts on medicines by providing members of the healthcare team with current scientific and evidence-based treatment options for individual patients. This means that more pharmacists will have to be employed by the Ministry of Health of Ghana and the Ghana Health Service, the teaching hospitals, and all hospitals and clinics. This is because all of these facilities provide medications in one way or the other directly to patients. And this will go a long way in assuring patient health and patient safety. Increasingly, in recent times, we have seen the trend of pharmacies and dispensaries in both public and private facilities being manned by unqualified staff, putting restricted medicines, that is class A and B medicines, in the hands of unqualified personnel, which is very dangerous. And it is a recipe for disaster, putting the health and life of patients and members of the public at risk. And this has to be addressed as a matter of urgency.
Well, he says the Pharmaceutical Society of Ghana is ready to lend its support to government and the aggrieved members of the Government Hospital Pharmacists Association who are still on strike to address the impasse.
The PSGH leadership has offered to play a key role in engaging the Ministry of Health, the Ministry of Employment and Labor Relations, Ministry of Finance, and the Fair Wages and Salaries Commission to bring the unfortunate 6-year impasse with GOSPA on 3 key issues: their conditions of service, the interim market premium, and then the grading structure. We believe that our collective efforts must be geared towards finding an amicable solution to this protracted labor dispute without compromising the integrity and quality of pharmaceutical services and care that Ghanaians deserve. The PSGH finally wishes to assure government and GOSPA that it is willing and ready to provide any assistance towards a swift resolution of their differences to ensure an immediate resumption of pharmaceutical services in public health facilities.
Meanwhile, as you may know, today marks exactly the end of the 10-day ultimatum given government by GOSPA to intensify their strike. Over 600 members of GOSPA declared a nationwide strike on the 5th of September following a breakdown in negotiations with government over their interim market premium, grade structure placements, and their conditions of service. Well, the group threatened to withdraw their emergency and inpatient services, but former GOSPA chairman and an executive member of the body, Stephen Kokwe, says they are yet to carry on their threats because they have some reasons. Let's hear from him.
Yes, we are on industrial action, fighting for our total remuneration, which six years ago have been reduced to the minimum level. It has made us worse off. It has reduced our pension. It has made pharmacists' morale come down. A lot of pharmacists have left the public sector, and that is not very effective for pharmaceutical services to go on in the public and the private hospitals. That means that there will become a time when you go to the hospital, there will be no intervention of somebody who is an expert in medicines. And that means that you and I, when we go and there's a medicine that has been prescribed for us without the intervention of a pharmacist, but on unqualified personnel, which now we have heard from the ministry that they have instructed that unqualified personnel should stand in for pharmacists in the public sector, then we are in real danger. It means that when you go to the hospital, you are dish out a medicine and there's no expert knowledge of the person who is supposed to actually check whether the medicine that have been given to you is in the proper perspective so that you get well. Mind you, medicines can heal, it can cure, but the same medicine can damage you and can make you ineffective.
Okay, Mr. Gokwe, I know that over this period you have been meeting government trying to resolve this issue. How far has it come? Because I know today also marks the 10th day that you've given government. I know you extended the period that after 10 days you are going to withdraw emergency service as well as inpatient service. How far with that?
In fact, anytime we go on strike, we don't go on strike because we want to. It's because for a particular reason we have been pushed over to the hall. We cherish our listeners, our clients and our customers very well. So when we go on strike, we always want to put that human face. That is why we decided that we have to extend this emergency thing. Now, today, as you said, is the 10th day. We have decided to take stock of what has happened. The minimal interaction that we have with government and the employer, and see how best we can review our strategy from tomorrow. So we will relate to you as to our strategy from next week.
Do I get the understanding that you are no longer going to withdraw emergency and inpatient services like you said?
Well, that will be not by me alone. It's a collective decision by the national delegates, and once that is arrived at, we'll let you know.
Over this almost 3 weeks period that you have been on strike, what has been the posture of government, considering the number of meetings that you've been called to, the NLC and all that? How far has it come?
Yeah, the posture of government has been very good. Although we have made some little inroads, we think that government should have made that issues better, and because of the fact that our services are very crucial. You know, whatever you do, medicines are, especially when it comes to your health, medicines are a very important role. In fact, they play about 65% of the total medical cost. So if you not handle it well, then you make sure that the health of the whole nation is well in danger.
Would you say some positive gains have been made, and what exactly has government opened up to now?
Well, I wouldn't like to talk about it now because, as I said, we will need to take stock of whatever engagement has gone around and whether we would have to review our strategy for the next couple of days.
So let's see what this will mean in terms of the negotiations between gospel and government as they seek to have their issues resolved. Well, residents of 3 communities in the Tamale South constituency of the Northern region are worried about the absence of a wooden bridge that links the communities. The bridge, which was washed away by heavy rains months ago, remains unconstructed. At the moment, residents, including school children, walk on heavy rocks dropped in a gully created by the heavy downpour in order to cross over to either ends of the communities. 4 children have already lost their lives as they attempted moving from one community to the next. Residents want the bridge fixed as soon as possible to prevent the loss of more lives. Martina Bugri has more.
Hussein Nabila is a resident of the community. Speaking to Joy News, he indicated that several letters to city authorities and the Member of Parliament for the area to help fix the bridge has not yielded any results.
We are appealing to the authorities, particularly Metro. We have personal written letter to Metro. We are also written letter 4th of last month to our MP, that's Haruna Idrisu. And we are also written letter to Urban Road, but we are not seeing anything. They have not come in to tell us that they have plans to us. So that's so far what we have gone. So we want them to do some bridge and get at least one road that people can cross over from this area, Dunkukuko, to the Bambara side or the Disco side.
School has just closed, and these pupils of the Nahada and Badaira Islamic Primary School have to maneuver through this huge drain each day. The fear is that any of them can be swept away with a miss in the navigation. Watch as this little girl and her sibling are struggling to cross the moving water. Nabila tells me residents fear anytime there is a heavy downpour, as anyone using the bridge can easily lose their lives.
We have lost a lot of lives through this bridge. I don't think one will be elated for that or happy for that. What happened that I can count no less than 4 lives that the community have lost. That's those who have even grown up. And what happened, I recently a pregnant woman lost his child because of that. He couldn't cross over. We couldn't have a vehicle to access. So that's the life that we have lost. But I can count those who have grown up no less than 4. But for pregnant women and those who are suffering, for that.
The situation is obviously affecting school activities in these 3 communities. A teacher of Nahada Islamic School, Frank Mawalo, says the situation needs urgent attention.
Actually, it's a difficult thing, but then children coming to school, or to be specific, our children coming to school, only for them to be able to come and then cross how do they call it? At certain time, maybe now the water level is very low, probably they may be able to force their way through, but when the water level get to a certain stage, you will come to find out that they will find it very difficult even to cross. They cannot even cross in the very first place, not for us to be able to even see them in school, for them to, how do they call it, participate in learning. We are still, thinking about how to be able to reach the authorities' concerned so that they will be able to come and help us put the place into a proper shape so that our children will be able to have access to the place and then be able to come to school.
Martina Bugri's report for Joy News.
Quite a tough one to look at from the northern region. Well, more people are benefiting from the several social intervention programs currently being implemented by government. Well, in the Volta region, more than 7,000 exercise books have been distributed to students in about 50 basic and junior high schools in the Akachi North District. Some 975 students are also said to have benefited from government's free school uniform program. Kwame Asare has more in this report.
Distribution of the school uniforms forms part of the NDC's Better Ghana agenda to provide free school uniform to pupils in deprived communities across the country. According to the district chief executive, James Gunu, the provision of the school uniform is to ease the burden on poor parents and also motivates the pupils to take keen interest in education. He also indicated that Ghana will see more of these free social intervention programs aimed at improving the livelihood of Ghanaians as outlined in the NDC's manifesto.
More teachers are being trained to fill the classroom. We are providing the people food at school. Our 2016 manifesto is a gift from God. Just like how Moses went into the wilderness and prayed to God for the 10 commandments, so did the leaders of the NDC. And we are given direction from God to streamline the manifesto to aim at the well-being of Ghanaians, facilitate economic growth, transparent government, and rapid infrastructure development.
Alaba Nyokodo Miano Kujiba Yaba Dukoplo La Sochi Bantoa Nyakleda Amo Kwakpoklo Chino Nyaweba Mapetopoma Kwachina Ajema Yemiakpoboba Elianape Ganya Uchofo.
James Kudu mentioned that about 850 residents are benefiting from the Livelihood Empowerment Against Poverty LEAP program in his district. He added the district assembly has also introduced a local economic development fund to provide traders with soft loans to expand their businesses. He mentioned that the MPP's promise to give $1 million to every constituency and also restoring teacher and nurse trainee allowances. The chief of Avevi, Toby Adelakpi, who spoke on behalf of the beneficiaries, endorsed the NDC government and commended the DCE on his developmental agenda for the district, especially in the education sector.
Previously, when we were in the Akachi district, we lacked development. But after being allocated the district, we have seen much infrastructure improvement, especially in the education sector. Our children now speak good English, and I want to urge us all to ensure we maintain the NDC government so that they can rapidly develop the
Meanwhile, 150 women have been provided soft loans from the Microfinance and Small Loans Center, MASLOC, in the district. The beneficiaries, who were taken through a capacity program on how to effectively manage their businesses, were also given an average of 500 cedis soft loans each. Fred Kwame Asaris reports for Joy News.
Quite a good report to bring from the Volta region. People benefiting when others also are struggling to get some. Well.